your Houston chiropractor, Dr. Gregory Johnson, and we're here with Erica today. And Erica's driven not 6 hours up here, right, from Mission, Texas, to see us. And she's been dealing with the hiatal hernia for a while now that she hasn't found any relief for anywhere else. So that's why you came here originally, right?
Yes, sir.
All right, good. So we've had one treatment so far, and we're going to do number 2 and then number 3 all today, this morning and this afternoon.
Yes, sir.
So let's check your posture first and show them what we do. Okay, let's have you flex your head forward and then backwards, please. And then neutral, yeah. We really, people from out of town that come see us with the hiatal hernia, a lot of times we will see twice a day because we're really trying to get a significant change in the alignment of the rib cage and the spine. Okay, let's lay on back here now. And by the way, we got our pins fixed on our decompression table, so we are now back in biz. We got just a couple of little finishing touches that are still going to do them. And we got the pins in here so we can stabilize the pelvis. There we go, good. Okay. Now, raise the legs up to where they're parallel with the floor. That changes the angle in the pelvis and relaxes the spinal paraspinal muscles. And for different people, that's different heights. Usually kind of bring them back just a little bit to try to get a different angle in the pelvis. That should feel pretty comfortable, right?
Yes, sir.
This is the best way to sleep too, by the way, on your back with your legs elevated. Now, I know most of you don't have a table like this at home.
No.
So just prop your legs up with a couple big pillows. Or you can lay on the floor and put your legs up on the couch. That's a similar position. And then I get the towel wet so I get a better grip and get her ponytail out here. There we go. Good. Okay. Yeah. This is her first time getting this done. So take a deep breath in through your nose and keep your teeth together and let your hair out and just relax. There you go. Perfect. Yep. Did you feel that all the way down?
Yes.
Yep. She did good on that first one. She didn't yell and scream too much. And she is still kicking, see? Yeah, there we go. Your reflexes are a little bit lower than I would like to see. Okay, let's get your cervical spine while you're in this position. That's it. There we go. Good. Now, notice I didn't say anything there because I know y'all like to hear those cracks. Got a bunch of crack addicts out there watching us. Which is good. Welcome to you. Okay, let's come over here on your tummy now. There we go. There. There we go. Yep, perfect. Yeah, let's relax those there. So we're going to adjust her sacroiliac joints first. Her right leg was just a tad shorter than her left leg. There we go. So that's the right SI, and then I adjust the sacrum straight superior to inferior on the y-axis. And then the left SI joint, we're going to do that a little bit differently because it's internally rotated. Got a little bit of rotation here still. There it was right there. Good. Now we're going to adjust her lumbar spine. There's L5, L4, L3, L2, and L1. And just breathe normal. There you go. Okay. So it all out again. Perfect. And just keep exhaling. Yep. I'm going to put your head down just a little bit here. So what we're doing now is we're getting really good movement in her thoracic spine, which also in-houses and affects the sympathetic nervous system, which is part of the autonomic nervous system. And it's very important to get those sympathetic and parasympathetic nerves functioning properly so that we are in a state of homeostasis in our internal metabolism and working environment in our bodies. Homeostasis means that you are functioning normally in health, equally balanced throughout your physiology. And the opposite of homeostasis is dis-ease. Your body's not functioning in ease, it gets dis-ease. And you notice that a lot of times in elderly people and as we get older, because dis-ease takes place over a period of time in most cases, unless traumatically induced. So these are real tender too, huh? Mm-hmm. Yeah, these are rhomboids and they get very tight, especially when you have that forward head posture and it starts pulling your head forward and increasing your shoulders, rotating forward and rounding, and that increases the weight bearing in that area as well. So the heavy stress areas are right where the neck and upper back meet, right where the mid back and lower back meet, and right where the low back and pelvis meet. So we've addressed all three of those. And her legs are exactly even this time. Do you feel any tightness or pain there?
No, sir.
Okay, great. So we're going to be nice to her today and use this Genie rub on her instead of the Turbonator. She doesn't really need that. She got up at 3 o'clock to be up here in Houston, so we're going to make sure we get her everything she needs on every visit. She'll be back this afternoon to do this same thing again. And you can get adjusted several times a day, by the way, and it will not hurt you if you're going to a chiropractor that knows what they're doing. I do recommend, we get calls here and emails every single day wanting me to refer them to a doctor just like me in their city. The only thing I can tell you on that, besides just 2 or 3 doctors around the country that I know personally that does similar adjusting to me, one's up in Northern California, in Auburn, and the other one's in St. Petersburg, Florida. Other than that, you would just want to look for a Palmer graduate who does diversified and chiropractic biophysics technique and that has experience in treating the underlying cause of hiatal hernia. See, I'm not really treating her hiatal hernia itself, I'm treating what's causing it, which is mechanical in nature. It's where the thoracic spine vertebrae are subluxated or misaligned. They then attach to the ribs and misalign with the ribs. Then the ribs change their configuration, and the diaphragm, which is a muscle that separates the chest cavity from the abdominal cavity, gets weak, and it lets the stomach actually slip up through it and secrete acid into the esophagus. So to fix that, to actually fix it non-surgically, we just correct the structure, the rib cage, and then the diaphragm strengthens up by doing good breathing exercises and maintaining your good posture. So let's go ahead and turn on your back now. Now I'm going to just do a cervical Palmer diversified adjustment on her cervical spine. Now drop this one right, might tilt left just a little. There you go. Better. See, everybody that we see that has this always has forward shoulders, so we try to get those shoulders back where they need to be. And I'm going to adjust her entire leg and hip right there. Did you feel that all the way up?
Yes, sir.
There we go, good. Okay, now here's the really important part for hiatal hernia patients. Yeah, just rest those there for a sec. You want to get down below the xiphoid process, right underneath the sternum. Okay, take a deep breath in. Have to take a deep breath and then let it out and keep blowing it out slowly. Just keep blowing it out. I've got the stomach, the top of it right there, the fundus. I'm pulling that down. Yeah, there it was right there. Did you feel how hard that was? Another one now, deep one. And I usually do this 3 times in a row so that I can get that stomach pulled down as much as I possibly can in this time frame. And one more now. What you don't want to do is get right on top of that xiphoid process at the tail of bottom of the sternum, because then you can cause a sprain or even dislocate that xiphoid process, and that's very painful. A lot of patients who have acid reflux also have a blockage sometimes in their ileocecal valve. Yours is not too bad, but did you feel that gurgle?
Yes, sir.
So that's, I'm opening that up.
Sometimes I feel like
It's
soreness.
kind of right, yeah, it's kind of right where the people would think their appendix is as well. And then on this side, there's a valve between the large intestine and the rectum and the lower rectum, so that we want to get that valve working. And this one, make sure her ribs are lined up better. Now see, her ribs are pretty equal right now. That's good, but we are going to have her slide down on the table all the way for us there, where your legs are hanging off. There you go. That's it. And let's bring your arms out like this. Perfect. Now, see, I'm adjusting her AC joint right here. She just brought in an MRI on her shoulders, and it did show some degenerative changes in the AC joint, which is acromioclavicular. That's your shoulder blade and the clavicle, or your collarbone, which I'm adjusting the sternoclavicular and the acromioclavicular joint simultaneously. Then we get right on the lateral part of the sternum and adjust the ribs straight laterally so that they line back up with the sternum the way they're supposed to. Let's turn that way for me. And if the ribs are fitting properly on the sternum, as well as in the rear and the costovertebral joint, which is where the rib attaches to the vertebra in the back, and get that stabilized and strengthened up, people don't have hiatal hernia anymore. No more acid reflux, no more heartburn. You can eat double jalapeno pepperoni pizza if you want to. Which we have a patient, that was his goal actually, is to eat a double jalapeno pepperoni pizza. Which I like those too. We adjust every extremity joint. Good. Okay, let's come over here in front of the mirror now. Okay, and last thing we're going to do is we're going to retrain her cerebellum to hold her in this newer alignment. So let's have you guys close and go forward and backwards one more time. Yep, down neutral. So we've still got a little lateral translate. Take a look. Her chin's up a lot better and her head's back more now. But she's still translated to the right, so have her lift her shoulders up with her traps, pull back with the rhomboids, flare the palms forward towards the mirror. I'm going to spread your feet a little bit, bang up. Then we're going to bring her head straight back in the Z-axis, translate it to the left, which is the exact mirror image of her current configuration. We adjust the atlas on the X-axis. Okay, what's going on with my gun here? That didn't get unplugged yet. There we go. Okay, and right there. I'm also going to get down in her rhomboids here too and just bounce on the muscle spindles. There we go. Okay, now let's have you go forward and backwards again. See, the range of motion is great on that. Did that feel smooth to you?
Yes, sir.
Yeah. Erica, would you mind telling our YouTube subscribers how you feel here after your first couple of visits on your hiatal hernia and your back?
I've been feeling a lot better.
Great. Is
Yes.
it worth the trip for you?
Yes, it is.
Great. Well, thank you very much for letting
Thank
us
you.
do the video today, and we're looking forward to the day that she comes in here and says, no more acid reflux. So this is your Houston chiropractor. We'll see you next time.